Today on the show, the strength of collaboration in cancer treatment. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This is the 5th episode of our international series, where we share conversations with the cancer care experts who took part in the first global panel discussion at the 41st National Oncology Conference hosted by ACCC. Today we speak with Dr. Mef Nilbert, who joins us from Lund University in Sweden.
We have approximately 70% of the patients treated in our university hospitals or comprehensive cancer centers, and 30% in more, let's say, local hospitals. We are working very hard now to establish a so-called cancer infrastructure. So we sort of work together on a national level. I think it's fair to say that this is not anymore in oncology the time for competition. It's the time for collaboration, especially if we should be successful in science, in precision medicine, in prevention.
Dr. Nilbert, what are the biggest challenges that you're facing in oncology in Sweden?
So we have, like elsewhere, growing numbers of patients and also a growing fraction of patients that are elderly, comorbid. We also have a massive increased number of opportunities, possibilities, new drugs, better treatments. So this is sort of the big challenge on how to make, so to say, both ends meet. And how should we best offer these sometimes elderly, sick, fragile patients the best possibilities of care, also the most affordable? In Europe overall, also within our countries or between countries, struggle immensely with data sharing. So it may be difficult sometimes to collaborate with Europe if you need to share data, which we typically do.
Are there any experiences you'd like to share with your American colleagues?
Prevention and early detection. That's, I think, an area where we have some lessons that may be helpful for you. One is the HPV vaccinations, where we are up to 85 to 90% HPV vaccination. And the simple success story there is that we do it in the school-based programs and for free. So kids are offered when they are 13, both boys and girls. That's been a success. And then I think also hereditary cancers, that it's been hard to reach out to hereditary or families with increased risk. But now that we actually do the testing in oncology or hematology, because we need that for the drugs, for the prediction of which treatment they should have, I think we see a new area of diagnosing hereditary cancers, which will also obviously help us prevent additional cancers in these families.
What gets you out of bed in the morning?
I think it's now, and it's always been, this fantastic development in oncology where you meet this incredibly interesting, humble patients who you really feel you can make a difference for. And at the same time, it's such a sort of challenging biology and the development of high technologies and new drugs. So it's really a combination of scientific sparkle, I would say, and then also combined with very sort of down-to-earth challenges and very good long-term relations with patients and families.
Thank you, Dr. Nilbert. Our next episode in this series comes to you from Nigeria. Make sure to follow so you don't miss it. Thanks for listening. Until next time, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.